First, we start by wrapping our client's head in a nice headband. Next, we apply our first hot wrap. The hot wrap feels really nice for your client and sets the foundation for our first cleanse. The first cleanse consists of a really nice massage for your client while clearing the skin of residual debris such as old makeup, oils from skincare products, etc. It's important to really take your time with this first cleanse. This is essentially the first physical contact you have with your client. Your touch is communicating a calm treatment where your client is safe to relax. We follow the first cleanse with another hot wrap to remove the cleanser. Next is a second cleanse. This cleanse is focused on a deeper cleanse into the actual pores. This is followed by another hot wrap to remove the cleanser. Next, we incorporate a toner. By toning the skin, we're ensuring all residual cleanser is removed. The use of a toner helps to balance the pH levels of our client's skin. Next, we massage with an exfoliant. Exfoliation removes the outermost layer of dead skin. We follow that up with our final hot towel. This removes the debris from exfoliation. The final hot wrap also ensures we're opening the pores up for a deeper penetration of the upcoming numbing cream. Next, we apply one final round of toner before we start numbing. At Lux, we use Zensa numbing cream. Here you see that I'm applying a thin but ample layer of numbing cream to the entire face. It's important to focus on numbing under the eyes as this is one of the more sensitive areas. After full numbing application, we let the numbing cream activate for the next 15 to 20 minutes. For each client, I mix up a cocktail of quality skincare serums that target each client's specific needs. These serums are applied to the face prior to needling to act as the glide during treatment. Now we begin needling. At Lux, we use the Bellis Medical Skin Pen. This is the only FDA-approved microneedling device on the market. Generally speaking, we start at a 0.5 millimeter needle depth. With each needle depth, we do 3 passes on each area of the face. After the first 3 passes, I kick the needle depth up to 1 millimeter. I treat at 1 millimeter depth for 3 passes, moving on up to the 1.5 millimeter mark. It's important to check in with your client as you increase each needle depth. I prefer to ask my client to rate their pain level on a scale of 1 to 10, with 10 being incredibly painful. Most clients rate the pain at a 3 to 5, emphasizing that this is not the most comfortable treatment. However, the results are incredibly worth it. As you can see, the client is starting to show a pinpoint bleed. This is absolutely normal and an indication that our needle depth is starting to penetrate into the dermal layer of skin. The dermal layer of skin houses your blood vessels. With microneedling, we aim to achieve a pinpoint bleed. Blood consists of platelet-rich plasma. PRP has concentrated growth factors. This essentially uses your body's own growth factors to accelerate healing, and in turn your skin drastically benefits from the healing nutrients. As you may have noticed, so far we have not needled the forehead. We treat the forehead last as this is a densely bone-plated area. The bone dulls the needles of our device. I always end treatment by giving the client a mirror to check out their bloody reflection. After that, I snap a few post-treatment photos. For the DeLUX microneedling treatment, I apply an Esthi Max gel mask after needling. This particular mask helps to increase visible density and elasticity for a firmer, plumper skin. The post-treatment mask is chosen based on your client's specific needs. Jelly masks take on average 5 minutes to fully set up. The mask itself has a cooling effect post-microneedling, and then the ice globes further emphasize this cooling sensation. The mask itself needs to stay on your client's face 10 to 15 minutes to allow the active ingredients to fully absorb. After this, you can gently begin to peel the mask off. The mask is designed for gentle removal, and you can see how nourished the client's skin looks as you peel the mask back. After removal, I like to do another light massage with the ice globes. This seals all the nutrients we have applied during treatment into the skin. This is also the final cooling phase post-treatment. Take your time here as this feels really nice for the client. Last but certainly not least, we apply a nice moisturizer and sunscreen to our client before we send them back out into the world.